Vaginal estrogen saves lives. When a woman gets older and they start losing their estrogen levels, whether it's through surgical menopause or actually going through menopause, they can experience what's called vaginal atrophy, which sets them up for the genital urinary syndrome of menopause. What does that mean? It means the vaginal tissues shrink, they get less pliable, there's not as much moisture, and so you get a difference in your pH, which sets you up for increased urinary tract infections, painful intercourse, burning with urination, and reoccurring urinary tract infections. Vaginal estrogen can be life-saving in preventing these urinary tract infections. I personally have been someone that has neglected this as a clinician in the emergency department. At urgent care, I would see these women with recurrent UTIs, and I would tell them, hey, you need to talk with either your PCP or GYN on getting on vaginal estrogen. It would help restore these tissues and hopefully help prevent these. And urinary tract infections can be relatively easy to treat, but they can also be horrendous to treat. With these reoccurring, you can get antibiotic resistance. If it works its way up to your kidneys, you can get pyelonephritis, and this turn into a systemic infection where you need to go into the hospital and have IV antibiotics. And if it's untreated long enough, it can result in death, especially in nursing home, elderly, frail female. And so I want to really say that vaginal estrogen is safe for all of these females to help prevent this. Even post-breast cancer, if you're a smoker, these frail, elderly females in the nursing homes, they should be on vaginal estrogen to help prevent this. We put a lot of females on systemic estrogen, estradiol, meaning that we put you on estradiol absorbed throughout your body. That does a much better job at cardiovascular protection, bone protection. But 30 to 40% of these women will still need vaginal estrogen to improve, just the pH of the vagina, vaginal moisture, just help the tissues. Vaginal estrogen is so good that even the same vaginal estrogen, if you put on the back of your hands, they can be more useful. You put them on the face to help with wrinkles and fine lines, and just to show that it has good local tissue effects wherever it's applied. This is frequently a part of our hormone optimization replacement in women, especially if they have had any decline of genital urinary symptoms of menopause and need any additional support. If you have questions over this, of course, text or call. Tiffany or me would be happy to explain further for you.